and thank you for joining us for today's Oncology Nursing Society Daily Update. I'm Mary Jerome, Senior Director of Medical Communications and Education at the Multiple Myeloma Research Foundation. I'm here in Anaheim, California at a national meeting of oncology nurses known as ONS. This meeting is held every year, and it brings together oncology nurses from across the country who present and discuss clinical topics on all cancer types, including multiple myeloma. I'm very excited to be joined today by our Patient Navigation Center nurses, Grace Allison, Brittany Hartmann, and Erin Mensching. They've been attending many of the sessions and will summarize for us key points about myeloma that they've learned. So I know that when we educate patients and their caregivers about myeloma, we tell them that treatment is for life. It's really a chronic disease for many patients. And because the nature of myeloma is to respond and then relapse over time, patients will not only be on treatment for life, but also be exposed to many different treatments. This can take a toll on patients physically, emotionally, and even financially. Erin, I'm going to start with you on this one. Based on what was covered today, what can you tell us about the physical demands of a patient with myeloma, both treatment and myeloma related?
So as we know, myeloma is associated with a really high impact on disease burden. And this can really translate into decrease in quality of life. And oftentimes the physical aspect of the disease is often the most challenging. So we really do, as nurse navigators, we want to encourage patients and caregivers to speak up about each and every side effect or aspect of the disease, whether it's pain or fatigue. And these are common, but they're very common. So we also urge you as patients listening to not assume that it's part of the disease and not assume that these side effects are normal, and to really speak up about each and every little aspect so that they can be addressed. For instance, relating to the physical aspect, pain can be whether or not you're 30 or 50 or 70 years old when you're diagnosed. Pain is often associated with the disease or as a treatment side effect. And there are tips and tools to help with this, so we really encourage patients to speak up about this part of the disease. And then I also wanted to mention that there is a care team ready to help patients and to ask questions about how the care team can help. There's psychologists, nutritionists, physical therapists who can really be helpful to helping to regain strength. And there's a lot of tips, there's a lot of resources out there, so we just want to encourage patients to speak up about each part of the disease that's impacting their life.
So communication is key,
it is,
basically.
Very important.
That's great advice. So Grace, what was discussed at ONS that might help address some of these treatment and disease-related burdens for patients?
So you just mentioned one of the most important parts that we had learned about this week, Mary, communicating with your physician. And when you go in and see your care team and they ask you how you're doing, it's not a virtue to say, I'm fine, because it doesn't benefit you and it doesn't benefit the treatment team. They want to know how you're managing on the treatment that you're undergoing so that they can maximize its impact. If you don't communicate when you're struggling, then it might get to a point where they've not been able to intervene and manage, and then the treatment might be stopped prematurely and you don't get the benefit. And a lot of times drugs have to be, tailored to a myeloma patient's disease. And if you come off one prematurely, it may impact you long term. So having that conversation, letting people know how you're really doing so that they can give you ways to manage it, that's really important.
Yes.
So being open.
Being open.
Yes.
Great. So Brittany, what can you tell us about some of the therapies that multiple myeloma patients take frequently and some of the side effects that they get from these medications and how patients can deal with that better?
So a lot of these treatments can cause nausea. That's a really big complaint within the community, a big side effect that can interfere with day-to-day life. And to go off of what Grace was saying with being open and speaking with your physician, these medications, that's something that you don't want to deal with every day, but this treatment is really working for you and helping you. One of the sessions, there was a case study where instead of just stopping the treatment altogether, they just did an adjustment for taking the anti-nausea medication about 30 minutes prior, and the patient was able to stay on therapy. So instead of having to change and go to a whole new line of therapy, these supportive care measures can help a patient remain on something that is working. And aside from just medications, because I know a lot of patients are on multi-drug regimens and are concerned about starting another medication to combat a side effect. So there's other options. One of the treatment toxicities, preventing treatment toxicities, talks that I went to, the nurse had piloted on an inpatient unit actually utilizing peppermint oil as an anti-nausea regimen, and it was shown to be effective, and they're actually utilizing it and continuing to use that on their unit.
That's interesting. Yeah.
And in our hospital, actually, we had a nurse who trialed. It was very similar to the nausea that pregnant women were experiencing. So they had these acupuncture points on the wrist. So we trialed these bands that put pressure on that acupressure point, and they were successful. So instead of a drug therapy, complementary approaches and just being creative. Nurses are very creative when patients are suffering, and they want to just find ways to help that may not be drug use. So
Sure. So I know that many times when we hear from patients, one of the main side effects that they talk about as being very debilitating is neuropathy. So, and I know that there are some certain things that can help with neuropathy. Sometimes it's a dose reduction, sometimes it's not taking it as frequently, but what else can work for? I've heard things like crazy things like pickle juice and things like that.
I think...
Or tonic water.
Tonic water. Speaking with your physician, letting them know that you're having this problem, sometimes it can be related to other conditions. We heard a speaker who described a patient who had multiple myeloma but also had diabetes. So it was, what is really contributing to this? Are we able to better manage the blood sugar levels? Better management of the diabetes, would that help? So being aware of what the whole person, and then when you start experiencing peripheral neuropathy, it can present in many ways. It can be just tingling or numbness, but it also can be painful. So drugs are useful, but then there are other, again, complementary approaches. We saw somebody who was using essential oils in the session where they were using frankincense. We've heard of physicians allowing patients, if it works for them, to try B vitamins. And then also acupuncture has been mentioned as successful. I've had some people say that that's worked for them. So constantly communicating with your team, asking about the dose adjustments, but also seeing what works for you as a person. Exercise was brought up, and they said, that it may seem counterintuitive when you're in pain, but having that exercise going on every day increases the blood flow and increases the blood flow to the nerves, so that you do find an improvement in the patient's well-being overall. So that was brought up. I thought that was very interesting.
So would the procedure be for just a patient who was experiencing these symptoms, just basically try something and see if it works, and then if it doesn't work, then they try the next thing on the list, kind of thing, till they find what works for them? Because I'm sure not everything works for every patient.
Exactly.
I know that a lot of times what I've seen done in practice is actually, as Grace mentioned, it could be the myeloma, it could be something like diabetes, is actually, and just in general, you want to treat the source. You don't want to just mask it. So you can ask your doctor about doing a neuropathy panel. There's a lot of blood tests that can show, is this some sort of vitamin deficiency that you just need to take a supplement, or just investigate it a little bit further. But sometimes these are trial and error and a combination of things, not straightforward as you're just going to take a medication and it's going to go away. But rather than that, you can use, again, some complementary things, increase your activity, and just approach it overall.
So I would imagine this is really important, because it's really important for patients, especially if they're on a therapy that seems to be working for them, that they control and really mitigate these side effects so they can remain on that therapy. So not only is there toxicity and effects of the disease and also of the treatments that myeloma patients have to take, but there's also financial impact of some of these myeloma treatments. And so, Brittany, can you explain to us what is financial toxicity? Is this a new term?
So financial toxicity is something that has really, I think, just recently been investigated as part of a disease process. Not only are you dealing with these medications, which are very costly, having to deal with your insurance providers, but there's other factors such as how often do you have to go to the doctor? How are you managing for transportation? Are you local to your treatment center? So there's a lot of things to consider. Luckily, there's a lot of organizations that offer grants. They're usually donation-based, so they can change time to time. But the good news is that there have recently been 2 generic for both lenalidomide and bortezomib, which are typical for first-line therapy. So we're hopeful that that will help with the financial burden for patients. One of the sessions, actually, one of the presenters mentioned even reaching out to your community. For example, the church did fundraising to be able to raise funds for a patient. So really just utilizing all of the possible resources, speaking with your insurance provider. The social workers are a really great resource at the hospital and can guide you towards, sometimes there's local funding, things that maybe on a national level we may not be aware of. So really knowing how to utilize your resources all around you can make a big impact.
So basically, this is an issue for myeloma patients, but there are resources available. So again, it's important for patients to speak up to their care teams at their centers, speak to social workers, find out who has the information that they need, and then go to those folks and find the resources that they need that relate to their financial situation.
Yes. So as Erin had mentioned, the care team is not just the patient and the doctor. It's a really robust kind of network of individuals that can help, and knowing who to go to for different things will really be able to help patients get the most out of their treatment and improve quality of life overall.
Let's switch to another topic that was the focus of a session that you attended called Disparities in Multiple Myeloma with African Americans. So we know that the Black community is at a higher risk to develop a myeloma precursor condition, and that multiple myeloma is twice as common and twice as deadly for Black patients compared to patients of other races. So I'm going to start with you, Grace. What are the disparities in diagnosis and care for Black myeloma patients, and why do they exist?
Some of this is originating in the history of how Black and brown people were treated in the medical community. It created this level of mistrust, so that we have found that Black and brown people do not access care as readily. So they delay going to see a physician even though they have complaints because of that. And access to care can be a little bit more challenging also. And so what we at MMRF believe is that every patient with myeloma should receive maximum therapy for a really, really good outcome. And so raising awareness is really important in the African American and other communities, letting people know that bringing to your physician's attention issues such as pain early prevents people showing up with advanced disease, which is harder to get a hold of, harder to manage and harder to treat. So raising awareness is important, and having an accurate representation of them in the community overall, that's really important.
So, Brittany, I know that there are certain therapies that Black patients are less likely to receive that has been shown in certain studies. So can you elaborate a little bit on that?
Yes, one specifically is stem cell transplant. So the outcomes for patients, as we've learned, if they do access care, is very similar. The Black patients or white patients respond. Sometimes actually Black patients have better outcomes even. So it's important for patients to be educated and know that stem cell transplant is still a research-based, very great option to get patients into a deep remission, especially upon induction therapy. One of the things that is sometimes limiting with that is the ability to actually move forward with the transplant because of a lot of different factors. Having a caregiver is a very essential part of the stem cell transplant process. So the session did mention how not only do you have maybe the patient themselves that is going to have to be out of work for 3 months' time typically, you have the caregiver as well who then has to cover the additional finances, getting them to these appointments, being there to be able to care for the patient and do the things that they're not able to do themselves. So that is one of the limitations that they did mention in stem cell transplant. So again, utilizing resources, speaking with the social worker, making sure that you are bringing a caregiver to your appointment upon the initial appointment and whenever you can have support there. It's important because it's good for people to know that stem cell transplant, though it can seem intimidating, it is still a really great option and patient outcomes are much better.
Yes. So still seen as standard of care.
Yes.
Although, we'll see what happens as therapies.
A lot of
develop,
emerging
right?
therapies,
So, yes,
yeah.
right, correct. So, Erin, what can you tell us about clinical trials and the Black community, right? So I've heard a lot of physicians say lately that now not only is stem cell transplant the standard of care, but clinical trials in myeloma can also be seen as a standard of care, especially for patients who have really run out of other options. Mm-hmm. So what can you tell us about African Americans and participation in clinical trials and how important that is?
So African Americans are underrepresented in clinical trials. And we'd really like for this to change because in order to give good data and good information representative of the population, we really do need more African American participation. And historically, there has been a mistrust of the medical community. And so I just wanted to point out a couple facts about clinical trials is that once a patient consents to join a clinical trial, they are very carefully monitored. Not only that, but they have earlier access to important treatments that are coming out. They can speak up about their side effects, and this is all collected. It's all really important information to help these treatments become approved. And I just want to reiterate too that it's not that there is a placebo. So there is a misconception out there that there's a placebo involved, and with these trials there isn't. So we hope that this will change over time so that the data can be more representative of the actual myeloma community.
Yes. That's what we hope. So certainly we know that because Black patients are twice as likely to have myeloma than other races, that we need to have, if 20% of patients in clinical trials should be Black, from the Black community, right? Because essentially 20% of myeloma patients are Black, right? So what that does is it ensures that the results that are coming out of the clinical trials are actually applicable to every myeloma patient, right? If you're having clinical trials that are only including one race, then the results that come out of that trial and whether or not the drug works or not, it may not be the same in other communities. So that's why it's so important.
And I think it was highlighted in a lot of these sessions. Research is such an integral part of myeloma. This is how we get these new therapies approved. So one thing that we've seen a ton is the timeline of treatments, starting in the 90s just with steroids and then the introduction of stem cell transplants. Where we are now versus 20 years ago, it's leaps and bounds. So the participation in these clinical trials to get these drugs approved is really important to patients now and in the future.
It's important to every patient, really. And I think all myeloma patients should be very grateful to patients who have come before them who have volunteered for clinical trials, because that's where all the new drugs come from. Nothing is approved without, extensive study in clinical trials. So it's really important for all patients to stand up and volunteer for that if they can.
And to know that a clinical trial is possible at any point along their myeloma journey. You can join a clinical trial at the very beginning, but clinical trial is an option at any point. If it's suitable, a physician can have a mind to what would suit you as an individual. But to your point, they can't postulate that the outcomes are going to be the same for everybody until we have correct representation of the whole community.
Exactly. you tell us about the MMRF and the clinical trials and studies that we sponsor with the MMRF and in our Multiple Myeloma Research Consortium? And have we been successful as an organization in recruiting diverse clinical trial populations?
I believe we have. I mean, our COMPASS trial represented the African American community very well, and we learned a lot of important data from that, and it has been utilized to build clinical trials around what we've discovered, genetic-wise and otherwise. We had 1,150 people enroll in COMPASS worldwide, and that information is going to be very beneficial right now and also in the future.
Yes, and certainly that trial has certainly spawned over 100 publications to this point, and still going.
And it's still referenced in the studies. It was referenced in the session that we attended too.
Great. So I think that we definitely, as the MMRF, are really trying to do our part in making sure that we're enrolling a diverse patient population in all the trials that we are involved in, because that is part of our mission, is to find new therapies and potentially a cure for each and every myeloma patient. So that's the way we do it. So, ladies, my last question to you all is, what will be some of the main messages from what you have learned so far that you'd like to share with patients who call into the MMRF's Patient Navigation Center? Grace, I'm going to start with you.
I believe that we should let every patient know that communication is key, and letting them know that we are here to help them weigh out the pros and cons. And sometimes we have more time to help them discuss what the physician has proposed as a treatment plan, but we want patients to be informed. We want them well educated and able to make the decision for themselves, because there are treatments that could be suitable, that they are given options that they have to pick between two. So we want them informed, we want to be able to provide that information, and we want to be able to have that communication, that open communication, considering every aspect of their life. You know, it's okay to consider whether you want to go into the treatment center once a week versus 3 times a week. It's okay to say, I want to get ready for my son's wedding. I need to be able to take off for, a vacation. All of that is life, and we want the patient to be able to live their life, not to be governed by the therapy for myeloma, but to be also able to live with the disease and be happy and have a good quality of life. That's important. So keeping that open line of communication, I think, is very important to be able to accomplish that.
So Brittany, what is your overarching vision from what you've seen so far that you wanted to share with patients?
I think that one of the most exciting things is all of the new options of therapy. Again, I know that we spoke about the timeline of where myeloma treatment was 20 years ago. So things such as BCMA therapy, CAR T, which we're going to attend more sessions and learn even more about. These are really exciting things that patients hear about, and we're here to help educate them even more on what their options are. One of the sessions actually said, once you get to the point where you're relapsed refractory, which is an anticipated part of myeloma, it's now kind of, you look at all of these options and say, where do I even start? But that's a really exciting thing for patients, because one of the anxieties that patients have a lot of times is knowing that this is a chronic condition, but we want to shift this more so to, this is a chronic condition that you can live with and that you can manage with treatment, as long as you're speaking with your medical provider, and as Grace had mentioned too, making decisions that really fit each individual patient.
Right, making treatment goals known,
Yes.
basically, right? Erin, I'm going to give you the last word on this.
Okay, so one of the key takeaways that I gathered was we've been saying about communication and how important that is. And so I just want to say, and one of the nurse myeloma experts, she did say that so often patients will come in and say, I'm fine. So I just want to empower patients really to ask their questions, and maybe even to walk in with a list of questions and say, I have 3 questions today, can we address these before we move on? So, and also to utilize a caregiver, or if you don't have one, to bring in a friend. because they can often digest information that maybe you as a patient maybe cannot, and then also to weigh the pros and cons with a friend. In addition to the Navigation Center, we're here, but to also have these discussions with a family member or caregiver is really helpful too. So utilize the whole care team, ask questions, speak up about any issues, and know that we're here too as a Navigation Center.
Great.
I think as a whole, the myeloma community is just amazing. They support each other so well, and there's support groups that, people join, and a new diagnosis is able to get the benefit and the wisdom and hear the stories of the people who've gone before, and know that there is hope, know that there are therapies, know that there's ways of living with this disease. So, myeloma community are just amazing. They really are resilient people, and I'm just so in awe of them.
Yes. I'd like to thank Grace, Brittany, and Erin for joining me today during this busy but exciting time at ONS. I'd also like to thank everyone watching this update. We'd love to receive your comments about this video, so please fill out our short survey using the link in the description box. Finally, I'd like to thank our sponsors, Adaptive Biotechnologies, Janssen, and GlaxoSmithKline. If you have any additional questions about what you've heard today, you can speak directly with Grace, Brittany, or Erin by calling the MMRF Patient Navigation Center at 1-888-841-6673. We'll be back tomorrow with more updates from ONS.